Welcome back to Land Matters, the podcast of the Lincoln Institute of Land Policy. I'm your host, Anthony Flint. In this show, we continue our coverage of the coronavirus crisis and how it's affecting cities with a very special guest, Mayor Libby Schaaf, the chief executive of the city of Oakland. The Bay Area has been credited with moving fast with a successful lockdown and now is looking at a gradual reopening and recovery. The big challenge now, Libby Schaaf says, is how to build back better with a more equitable and more sustainable city than before the pandemic hit. I started our conversation asking about how her job has changed so radically as a result of this crisis, on a personal level and otherwise, beginning with one of the very first emergencies she faced, letting the Grand Princess cruise ship dock in West Oakland, with dozens of sick passengers desperate to disembark.
We are members of an interdependent human community that must put people over profits, that must put health first, and that we must model generosity and the right values in moments of crisis. And so I accepted the request. We made sure to constantly remind people of this historical context of environmental racism that had been visited upon West Oakland. And we also pushed our federal and state partners to go to extra measures to ensure community and worker safety during the operation. And so I was pleased that we were able to extend this helping hand to give these frightened passengers and crew members, hardworking people from all over the world that crewed that ship, who also were sick and seeking a place and way to get home. It was very heartening to be able to provide that safe harbor, but it was a very unusual entry for me into the COVID crisis, and one where my initial attention was almost external to these outsiders that needed help from my city, to then needing to quickly pivot internally as we began to see cases unfold right in our community.
So that sounds like a trial by fire. The first thing you had to deal with was this cruise ship, and it was successful with the help of various officials, and then you turned to managing the crisis in the city of Oakland.
You know, you asked me how my personal life has changed, and I didn't really answer that question. I should. I have not been to City Hall but one time in the last 9 weeks. So personally, my life has changed tremendously. On a personal level, I've learned that I'm really bad at cutting my son's hair. I've learned that my husband is an amazing cook. And I've learned that our slow streets in Oakland are an amazing comfort, as I got to enjoy the first one in my neighborhood recently. And so I personally am navigating some of the same challenges that my community is, as far as being, you know, a two-parent household that's working at home with 2 school-age kids. I have 2 kids in middle school. That's a lot of attitude bottled up in one house. At the same time, every day, I thank God that I have a paycheck. I know that a quarter of my workforce in Oakland has lost their jobs. And it is such a sobering reality. But to kind of convert my living room into a communications studio, to be recognizing how important public communication is right now. Pandemics need communication as much as they need kind of healthcare to really continue to push testing resources, the need to follow the health guidelines of wearing cloth masks and keeping social distance and maintaining the shelter at home. These are constant messages that a mayor is uniquely poised to be delivering. And so I certainly have shifted a tremendous amount of my time and energy to communications, to crisis management, but also to continually challenge my organization. And you'll hear me talk about this a lot. I want Oakland to be the silver lining city. I want us to exploit every opportunity in this crisis to make lasting structural change that needs to be made. It needed to be made before the crisis. The crisis is only exacerbating things like structural racism, like economic disparity, and we have an opportunity to not just respond in the moment, but to make some lasting changes and to take advantage of a new level of national awareness of these problems. The health disparities by race is something that is finally getting national attention. Let's take that awareness. Let's take what is hopefully an elevation of political will and pass some laws so that we don't see these kinds of disparities again.
Well, the Bay Area as a whole was really, by all accounts, quite successful in locking down, and now, of course, moving to a phased reopening. How has the gradual return to some sort of normalcy gone?
Well, I think it's premature to say that we've returned to any sort of normalcy. The Bay Area was the very first in the country to impose a shelter in place. And boy, am I glad that we were. It was hard, it was uncomfortable, it was a difficult message to deliver, although our job as politicians were to back our health officers. This is not a time for politics, this is a time for data and science. But we now know when we're looking at death rates in places like New York that are more than 10 times the rate of the Bay Area, which is maybe not quite as dense, but certainly similar. You know, we are really thankful that we took these dramatic actions quickly and that we are being much more slow and measured in recovery. Literally yesterday was the first day that it was announced that we may begin doing a curbside retail. Again, we're the last part of the Bay Area and California to allow that. So we went first and fastest, and we are coming out slower, and I believe that we will save thousands of lives, avoid millions from enduring suffering because of this disease. And at the end of the day, I believe our economic recovery will be better and stronger because of this moment of intense pain and sacrifice.
Well, you've received a lot of attention for the Building on the Slow Streets program and extending closures and other measures to accommodate social distancing and encourage biking and walking and using scooters. Do you think this might be a turning point for the public realm in cities everywhere?
Without question, this is a turning point. You know, I really want to shout out my director of the Department of Transportation, Ryan Russo, who saw the opportunity to repurpose deep analysis that had already been done to create our bike plan, so that he knew in an instant the 74 miles, the 10% of our roadways that were absolutely eligible to be shut to through traffic and used as slow streets. So again, recognizing that you can repurpose work you've already done in a crisis is brilliant. And I know that people are worried about the future of public transit. People are worried. Are we going to go back to the car culture where we have solo drivers in their isolated pods, spewing pollution and emissions and stressing out everyone because we're all stuck in traffic jams? We cannot go back to that hell. We have to move forward. And the slow streets are not just a place to give our residents a safe way to have kind of mental health respite by being outdoors, by having a safe, convenient place right in their own neighborhood to exercise, to send the kids out on their scooters and their roller skates to blow some steam off in a way that is socially distant. But it's a reminder that the public right-of-way is the public's. It's not just for cars, and that we've been underutilizing this precious asset in so many ways. And it has been truly one of my favorite silver linings to see the joy of our residents that are enjoying those slow streets. Because it's not just about slowing down, it's also about seeing the other members of your community in a socially distanced and healthy way to remind yourself you are not alone. You are part of a bigger community, and that we are all out taking care of ourselves, taking care of our families in a responsible and healthy way. And we're doing it on an asset that was there all along, but we were really denied the full use and enjoyment of those streets. I do not think that we are going back. I've already gotten tons of requests to make so many of the slow streets permanent. It has been a fabulous experience. We were able to do it quickly with almost no money. Literally, my mobility policy director, Warren Logan, borrowed my minivan, took a bunch of interns out to put up the first set of barricades and signs for our first slow streets. That is how, on a shoestring, we're doing this in the mayor's minivan. And the great thing is, if people don't like it, we can move it, we can shift it. We're experimenting, and government doesn't do that enough. And that's one silver lining of this crisis, is that people are trying things, and the tolerance for risk-taking from our public is much higher because they realize this is a crisis. We've got to do things differently. We've got to test things out, but we're doing it in a very responsive way. We are getting continual feedback from the public about what they like and what they don't like. We're shifting, we're evolving, but I can promise you that much of this is going to remain once the health crisis is over. People are loving it.
Well, in terms of mass transit, it's really the lifeblood of cities, and its fate is uncertain. How transit systems everywhere can operate at reduced capacity and have social distancing. A car, meanwhile, is pretty effective in terms of social distancing. So I'm wondering, how can mobility policies adapt to this new reality, and how you think mass transit will come back into the picture?
Well, I want to start with our bus system because they made some quick changes that have been wonderful. And again, maybe things that we're never going to go back on. One, they stopped charging fares. Boom, stopped. And what that allows them to do is board people from the back doors of the bus as well as the front. People are on and off faster. They don't have to go by the driver. Less stress on the drivers, faster operations, less touching and exchange. That is something that a lot of people have talked about for a long time, having fare-free transit. The bus, I think, is going to be much more adaptable to the social distancing measures. Not saying this is something that's going to happen, but I could envision plexiglass or even shower curtains between each set of seats. There are ways that we can kind of socially distance within public transit. Now that's going to be a lot harder on a BART car, which, I used to ride BART several times a week, and I joked about, getting close to my constituents because you definitely were pressed up against your fellow man riding BART during commute hours. And that is not something that's going to make sense for quite some time. But rather than get people back in their cars, we're excited about trying to accelerate the use of electric bikes and scooters. There's even some talk about giving out free electric bikes. The electric mobility options are certainly making bike riding much more accessible because you don't have to break a sweat, you don't have to wear spandex. Oakland, a long time ago used to have the nickname Oaksterdam, mostly because of our embracing of cannabis. But let's be Oaksterdam for bike riding too. It's a healthier way of getting around, it's safer, and that is a pivot that we can make. All I know is that we cannot afford to get back into our cars again. That is not an option.
Well, with all the economic disruption, sort of at a macro level, it's just staggering. But in terms of cities and downtowns, some of the basic building blocks, if you consider retail, restaurants, or office space, or residential, how is this likely to alter our future, our urban future? in terms of development, affordable housing, transit-oriented development, all of those things?
We've seen construction continue. People are continuing to pull permits. The Bay Area had a significant housing crisis before COVID-19. Arguably, it will have an even worse one after COVID-19, particularly for affordable housing and addressing our homelessness problems. And so I have been encouraged to see that development continue. I do think that we're going to evolve more rapidly around a car-centered downtown. Just like we had this success with our slow streets by creating recreational areas within neighborhoods by closing streets off through traffic. We are already working with our business districts to see if they might want us to close streets off so that restaurants and shops can spread out onto the sidewalk and into the roadway. We know that this virus is far more deadly in interior spaces, and particularly when people remain in a small interior space for long periods of time. So anything you do outdoors is going to be much safer. And so why not create more of a marketplace atmosphere that allows people to be outdoors, to not have to be close to people. They'll have room to spread out. And, it actually might make some of these commercial areas even more attractive to people that like that kind of European pedestrian feel, the vitality of an urban space, but without being shoved together into, a small club, more spread out. So I see these all as possibilities. Cities are not going away. Just because you have to socially distance 6 to 10 feet does not mean you can't do that in a small apartment with someone above and below you and next to you. Cities are efficient. They allow us to deliver services more rapidly. Sprawl is not a healthy response. Smart density and the agility and creativity of cities is what's going to allow us to not just get through this health crisis, but emerge with a more equitable, healthy environment. The lessons that we've learned of how our planet is benefiting from the lack of car emissions. We've got to keep these lessons and not just go back to business as usual. We need to go back to a better world and make sure that we have taken this moment and gotten every lesson that we can out of it while still guiding the evolution of cities with our values and taking advantage of this appetite for rapid change, for structural transformation. And that is really what our challenge and our opportunity is right now.
Mayor Libby Schaaf, thank you for this conversation.
Well, thank you. And I know it seems like a funny time to sound optimistic. This is a horrid tragedy. Like many people, I have lost loved ones to this disease, and the severity of it is not to be underestimated in any way. And yet we have to see these opportunities. We have to seize them. And that is kind of our challenge right now. And I think anyone who's the mayor of a major city has to be a bit on the optimistic side. It's what keeps us going, particularly during times like these. So thanks for giving me the opportunity to chat with you today.
Libby Schaaf, Mayor of Oakland, I think demonstrating some leadership, empathy, and some innovative thinking for how cities can get through this terrible crisis. By the way, you can read a version of this interview in print and online in Landlines, the magazine of the Lincoln Institute of Land Policy. It's this summer's Mayor's Desk feature. Just go to our website, lincolninst.edu. On Twitter, our handle is @landpolicy. Thank you for listening to this episode of the Land Matters podcast. Until next time, I'm your host, Anthony Flint.